Hello, this is another episode of our Whiteboard Wednesday. Today I'm going to be talking about a very exciting new treatment option that we have in the office. It's called LANAP. That stands for Laser Assisted New Attachment Protocol. Now that's fancy terminology for we can treat the gum tissue disease that the patients have and actually regenerate new tissue and new attachment. A little bit about the background of tissue and our patients' problems with periodontal disease. There's two types of periodontal disease or diseases of the gum, and that's gum disease, which is sometimes referred to as gingivitis. Others is called periodontitis. Gingivitis is just the presence of inflammation in the gum tissue. Periodontitis is the presence of inflammation in the gum tissue with the actual gum tissue and bone tissue being lost. Prior to LANAP, the alternative to the treatment of laser-assisted new attachment protocol was actually gum surgery. We'd send you to the periodontist, and they would have to do some surgery where they cut open the gum tissue and actually remove some bone and some infected tissue, and then sew it back together. As we saw that happening, a lot of patients would come back with loss of tissue and sensitivity in the teeth. In May of 2016, it was actually approved by the FDA as the only periodontal treatment that was FDA approved to actually do regeneration with the tissue. There are straightforward steps in the LANAP process. I'll go over those just briefly. After numbing the patient, we go through with the laser and actually just pass the laser fiber underneath the tissue a couple millimeters. What this does is it opens up the tissue and also starts the process of sterilizing and removing the bacteria and the viruses from the pocket. Once we are done with that process, we then come in with an ultrasonic cleaner, similar to when you come in for your hygiene appointments, and we clean the root surfaces of the tooth. Once the tooth surfaces are nice and clean, we come in a second time with the laser, and we go to the bottom of the pocket. We continue that sterilization process, but we also help the blood clot that is forming to set and to be set in the tissue. The blood clot has a lot of very important features, and we have to make sure that it stays there. So as the laser causes the blood clot to form, we then leave it there so that the blood clot seals off the pocket and keeps it clean and sterile. But it also has all of the components that are needed to help heal the tissue and help regenerate the bone and the tissue to regrow. One of the things our patients have reported to us is that the post-operative sensitivity and pain when we do LANAP is actually very, very minimal. This is a complete difference than what happens with periodontal surgery. It is surgery, and there's a lot of post-operative pain and healing that come with that. Most of our patients report that there's actually very little pain and inflammation for the next 2 to 3 days afterwards. One of the things that we have patients do after the LANAP treatment is we have them very, very gentle with the cleaning in that area that we've treated with the laser. Most of the time that's a soft food diet and liquid diet, and very, very minimal cleaning for the first 2 to 3 days. After that, we have you go back to gentle brushing and then on to normal brushing after that. We're excited to offer this innovative new treatment to our patients. Next time you're in, if you have any questions about it, feel free to ask us or the hygienist. We have a lot of information for you. We have websites you can go to. We've got handouts you can have. We've got videos that you can watch. We're really excited to share this with our patients. Thank you. Have a good day.